Very good morning to all of you. The title of the study which I am going to present today is Clinicodemographic Profile, Management and Treatment Outcomes in Advanced Retinoblastoma. Cursor is not moving. RB is the common primary intraocular malignant tumor. The management of RB is intricate and challenging, and aim of treatment is to save life first, then globe salvage and if possible preservation of vision. Eye salvage is possible in advanced RB, present error due to inclusion of new treatment modalities like ISC and plaque brachytherapy, but there is a disparity in this rate in developed and developing countries. Eye salvage in advanced retinoblastoma is also marred by many controversies. First, there is a risk of metastatic spread as regression of the tumor is possible with multiple sessions of chemotherapy. And second, this treatment is not free of side effects, which is not justified if the prognosis is poor in the affected eye. There are very few studies which have reported about outcomes in advanced RB. So hence this study was undertaken at our center to delve into the clinico-demographic profile, management and outcomes in advanced RB. It was done at Army Hospital Research and Referral, Delhi. It was a prospective cohort study. It was done for 3 years, 6 months. All advanced intraocular retinoblastoma cases were included, and patients with group ABC RB and patients who were treated somewhere else were excluded. 42 patients were recruited. Tumor was classified as per ICRB criteria. Systemic evaluation like CSF aspiration, bone marrow biopsy and PET scan was done on all cases. All ocular examination were done under GA and histopathological examination was performed where enucleation was done. In our center, we formulated our own treatment protocol based on the laterality, extent of the lesion and the results of already published studies. All patients were evaluated every 4 weeks and they were followed up for 1 year. The primary outcome measure was response to the treatment in terms of regression of tumor and no sign of recurrence after 12 months in enucleated eyes. And secondary outcome measure was complication associated with each treatment modality. So mean age of the study population was 13 months. There were 23 female and 19 male. Unilateral condition was found in 40 patients and 2 patients had bilateral retinoblastoma. Right eye was involved in 26 patients and left eye in 15. Common clinical presentation was leukocoria with diminished vision. Group D was found in 2 patients and Group E in 40 patients. Like all Group E patients were offered both IAC and primary enucleation, but 12 patients, their next of kin opted for primary enucleation as it was not possible for them to visit hospital every 4 weeks. And in 30 patients, we attempted globe salvage treatment. Systemic chemotherapy was given in 3, IAC in 27, and focal therapy like TT and cryotherapy were given in 5 patients. Plaque brachytherapy was recommended in 2 patients and secondary enucleation was performed in 6 patients. So in primary enucleation, the resolution was found in 11 patients, complete resolution, and implant exposure was found in 1 patient, and in that patient the MRI showed there was a recurrence of the tumor. So child had received 6 cycles of chemo followed by EBR. In globe salvage group, the complete resolution was found in 23 patients and no response was found in 3, and in 5 patients the recurrence was found, and in secondary enucleation complete resolution was found in 6 patients. So these are the photographs of few of our patients who had been treated at our center. So this is showing the enucleated eyeball with 15 mm of optic nerve, and this is showing a regressed RB, group E RB following 3 cycles of IC. So this photograph is showing the indigenous ruthenian plaque which was placed over the tumor. So over the period of time, globe preservation has improved even in advanced retinoblastoma. However, the risk of metastasis and recurrence is there with multiple sessions of chemotherapy. So the mean study of the study population was 13 months, and this was found in conformity with Shield and Aurora et al. As in their study also they found 90% of cases were diagnosed before 5 years. In our study, we found female children were found to be more effective, and this was not in conformity with Gupta and Padma et al. As they found no gender predilection in the study. So maximum patient in our study had unilateral presentation, and this was in conformity with Gupta and Galendo et al. In our study, the globe salvage was 100% in Group D and 52.5% in Group E patients. So we started chemotherapy in 3 patients and we managed to salvage 1 globe in this group. And in a study done by Fabin et al., they reported the 63% globe salvage rate with systemic chemotherapy. And in our study, the primary enucleation rate was less, and this was not in accordance with Malipatna et al., which reported primary enucleation, 100% primary enucleation in advanced RB. So histopathology of the eye showed high risk feature in 3 eyes, in primary enucleated eye and in 1 eye in secondary enucleated eye. So in our study, we could salvage all eyes in Group D and 21 eyes in Group B, And our study is one of the few studies which has addressed the outcome in advanced retinoblastoma, and the study has laid down certain guidelines for carrying out the future research. The main limitation was a small sample size, and it was a single center study. And to conclude, challenges in RB can be overcome by adopting holistic approach. Eye can be salvaged in this subset with a less risk of recurrence, and treatment with ISC with the 3 drug has found very favorable outcome in the study. And need of frequent follow-up for patients who are in systemic chemotherapy should be stressed by the treatment. Thank you.